Recent advances in transcatheter technologies and imaging modalities have led to increased use of percutaneous and hybrid techniques in the diagnosis and management of congenital heart disease. The direct closure can be used for atrial septal defect. Transcatheter closure is a common approach used to treat the secondum atrial septal defects and is currently accepted as the first-line treatment for secondum ASD amenable to device closure. For VSD, the transcatheter ventricular septal defect closure use the septal occlusion devices is challenging procedure complicated with proximity of the semilunar and the atrioventricular valves as well as conduction tissue for majority of perimembranous outlet and inlet VSDs. PDA closure of the is currently the standard care in infant, children, and adults. Meanwhile, the surgical ligation is reserved for very low birth weight infants and patients with ductal anatomy that is not amenable to device closure. Balloon valvuloplasty can be used in aortic stenosis. The transcatheter balloon aortic valvuloplasty is the first-line palliative therapy for congenital valvular aortic stenosis and is associated with a success rate of 70 to 60%. In pulmonary stenosis, balloon pulmonary valvuloplasty is largely replaced by surgical valvotomy in the management of the typical valvular pulmonary stenosis. Transcatheter pulmonary valve implantation has revolutionized the field of the congenital and structural interventional cardiology. Implantation of the right ventricle to the pulmonary artery conduit or a transannular patch resulting in the pulmonary insufficiency and commonly performed to treat pulmonary atresia or right ventricular outflow tract obstruction in infant and neonates. Balloon angioplasty and stenting is also important and can be performed in pulmonary artery stenosis and may occur in isolated lesion and concomitantly with other cardiac defects following the surgical repair or as a part of syndrome like Williams syndrome. Pulmonary vein stenosis may present with isolated congenital lesion or in associated with cardiac defect. It may also be acquired after repair of the anomalous pulmonary venous connection. Coarctation of aorta. The optimal management of coarctation is a topic of debate which varies based on age, presentation, morphology, and the presence of other cardiac lesions. Ductus arteriosus stenting implantation can be performed for patent ductus dependent pulmonary blood flow as an alternative to systemic to pulmonary shunts. Balloon atrial septostomy is another way widely used in neonatal palliative intervention to enhance the atrial mixing and demonstrate the left atrium and the left-sided obstructive lesion. Norwood procedures has classically been the initial stage of one palliation patient with hypoplastic left heart syndrome and other complex single ventricle defects and obstruction of the systemic output. The transcatheter management of the shunt may be performed in the aortopulmonary collateral arteries. These are the abnormal systemic to pulmonary arterial connection that can be found in association with complex CHD. Single ventricle patient can develop aortopulmonary collaterals with a resultant of left to right shunting leading to volume overload. Veno-venous collaterals often form the systemic veins to pulmonary veins and the right atrium to coronary sinus. The fetal intervention. The concept of the low impact vessels or the chamber growth is well established. In the development of congenital heart lesion, the recent advances in the diagnostic capabilities of the fetal cardiac screening and in utero transcatheter technologies provide an opportunity to optimize the antegrade blood flow, potentially halting the development of downstream structural hypoplasia and promoting biventricular circulatory postnatally. Thank you.